Today we are talking HIV in pregnancy. I'm going to start you off with a few stats. About 12% of all South Africans are currently living with HIV. KwaZulu-Natal is the province with the highest prevalence. 62% of all people living with HIV are actually women. And there's a 3 times higher chance of you getting HIV whilst you are pregnant. For those joining us for the first time, welcome. I am Dr. Koza, and I am your guide to navigating women's health in the public sector. Let's talk about how you can prevent yourself from getting HIV in 4 easy steps. 1, abstain from having sex. Yes, you can. 2, using a condom whenever you're having sex. 3 is if your partner is HIV positive and you are negative, they need to ensure that they are taking their medication correctly and their viral load is suppressed or undetectable. And then lastly, it is using what we call pre-exposure prophylaxis. Now, pre-exposure prophylaxis can decrease your chances of getting HIV down to just 2%. Okay, so this comes in different forms. The first being a tablet that you'd have to take every day. And the second that we have currently available in South Africa in the public sector being the injection that you can take every 6 months. So the Minister of Health has been very excited about launching this injection. To qualify for the use of pre-exposure prophylaxis, I'm going to call it PrEP moving forward, you have to be HIV negative, have no symptoms of HIV, and your weight must be more than 35 kgs. You'll still need to use a condom for the first 7 days while the medication takes effect. It is safe to use in pregnancy and whilst you're breastfeeding. You'll have to take an HIV test after a month and then every 3 months while you are taking PrEP. And you will also have a kidney test after a month and then yearly while you're taking PrEP. You stop whenever you feel you are no longer at risk of getting HIV. So whilst you're HIV negative and pregnant, you will be tested for HIV when you book at the clinic, and then at every antenatal visit when you are in labor, and 6 weeks after delivery. Yeah. If you're HIV positive and you are pregnant, this puts you at risk of having miscarriages, a preterm birth, and infections. Now, the chances of you transmitting HIV to your baby is higher if your viral load is unsuppressed, your CD4 count is low, you are in stage 3 or 4 of HIV, meaning you've got persistent diarrhea, persistent fever, you've got oral thrush, you have pneumonias, repeated pneumonias, or pulmonary TB. Or if you are being diagnosed for the first time with HIV in your pregnancy. The best way to protect your baby from getting HIV is making sure that your viral load is undetectable before you fall pregnant. If your viral load is unsuppressed, I want you to make sure that you are taking your medication correctly, meaning every day at the same time. Set an alarm if you have to. Also, have your healthcare provider check whether the dose you are taking is correct for your weight and for your kidney function. Thirdly, have your healthcare provider exclude and treat any infections that you possibly have at the same time, such as TB or any form of sexually transmitted infection. Also, notify your healthcare provider if you are taking any treatment for TB, diabetes, epilepsy, or you're on supplements such as your magnesium, calcium, and iron. They might just have to adjust your dose or the times that you take these different medication. And then lastly, your healthcare providers should exclude whether you are resistant to the current treatment regimen. Your viral load will be checked during your pregnancy, during delivery, and at 6, 12, and 18 months whilst breastfeeding. Yes, you can safely breastfeed while living with HIV. Your baby will be tested for HIV at birth, and if they are negative, they will then be given some medicine to protect them from getting HIV whilst you're breastfeeding them. Okay, that's a wrap for today. If there's any aspect of this talk that you'd like me to elaborate on, you know what to do. Just comment and I will address your concerns. Please don't forget to like, follow, and subscribe. And until next time, ladies, take care.